Funchain. I'm a medical oncologist. I treat melanoma and skin cancers. I spent a long time at the Cleveland Clinic, but I have just recently moved to Stanford. I have some specialties in the genetics of melanoma and skin cancers, but also in the immunotherapy-related adverse events that occur when patients are on immunotherapy.
Right. And you and Ginny, can you explain your relationship? I know Ginny came to you for treatment. Maybe you can give us a little bit of information about that.
Yeah, so gosh, how many maybe we shouldn't say how many years it is.
It was 2017, a spring of 2017.
So we met, Ginny had a stage 3 melanoma. And at that time, we were still trying to figure out whether it was useful to do immunotherapy after surgery, right? Because surgery is potentially curative in and of itself, but there is a high risk for recurrence. And at that time, we had just started with immunotherapy in the stage 4 setting, and we weren't sure if it works in the stage 3 setting. So we had a trial that was comparing two types of immunotherapy. So one was pembrolizumab or a PD-1 inhibitor. And then the other was ipilimumab or a CTLA-4 inhibitor, another type of immunotherapy. And we were trying to figure out what works best. And Ginny then had been randomized to the ipilimumab arm, which was that was the standard of care approved drug at that time.
It hadn't been approved for very long.
Yeah, no, not for very long.
Yeah.
But it was still part of this clinical trial.
It was still part of the clinical trial. And actually, it was one of the great things about the trial at that time was this was a very expensive dose of this very expensive drug. And we had actually had, even though had just been approved, I don't know, about a year before, it was actually really challenging to get that drug through insurance in a way that didn't cause financial toxicity. We had actually, I don't know if I ever told you the story, but we had a couple of patients before you who had had a lot of trouble. One patient, in fact, had a $2 million bill for that very same drug that you got. And the amount of months and person hours it took to clear that, we did eventually clear it, but it was rough.
Yeah, so, you could have just wheeled me to a different department at that point in time. If that happened.
Yeah, so even though it was the standard of care, one of the good things about the trial was we didn't have to worry about that cost.
Yeah. Wow.
Yeah.
Yeah, that is a good thing about clinical trials, definitely. But that's amazing.
Yeah, it was, I mean, that time period when you were being treated was sort of the Wild West in melanoma. It still is to some degree, but it was even more so
Yeah.
then. Yeah.